My name is Brett Lashner. I'm a gastroenterologist at the Cleveland Clinic. Today's topic was on fecal microbiota transplantation for Clostridium difficile infection, but also may have benefits for other diseases like ulcerative colitis. Many diseases like C. difficile are caused by a dysbiosis or an abnormal stool bacteria, fecal flora. And a fecal transplant removes as much as we can the old bacteria and puts in stool from a healthy donor that repopulates the bowel with good bacteria and crowds out bad bacteria like C. difficile. There's much less evidence that PSC is affected by fecal transplant, but as you know, PSC is very much associated with ulcerative colitis as well as Crohn's disease. So this is a relevant topic to people with PSC. For C. diff, it is very successful, about 90 to 95% success rate. And long-term success, you are basically cured of your C. diff. The success rate in other diseases that are not complicated by C. diff is much lower. There have been very few positive studies. There's some anecdotal reports that show it works, but research in this area is much needed. Trimethylamine oxide is a compound made by bacteria in the colon from the substrate of meat, eggs, some fish, some of the foods you eat, and that has been associated with atherosclerotic heart disease. So if you can repopulate the stool flora and give it bacteria, that does not create TMAO, you may have a treatment that will reduce the risk of heart attacks in patients. I do not recommend that it be done at home or away from a reputable medical center. There are potential complications. There are problems with both the donor and the recipient that could make everything much worse. The FDA has made it very clear that study in this area needs to be done under close supervision to make certain it's safe and effective in everybody. I mean, we're always looking for new ways to treat people, to reduce the risk of transplant. It would be really nice if we found some of these treatments. I'm just amazed that they have this conference. There are many people there getting excellent information from a lot of experts that will make them think, make them read the literature more, make them ask their doctors more and more important questions. I think this is a terrific idea, terrific conference.